Hello, this is Dr. Stuart Firsten. Thank you for taking the time today to learn more about spinal manual therapy. This video has been produced to help patients and healthcare professionals develop a better understanding of diagnostic and treatment procedures that patients may receive when under care. The following procedures are generally safe, effective, and well tolerated when provided by qualified practitioners. This video is not intended to be instructive. Spinal manual therapy requires proper training to perform. Injury could result if such procedures are performed by untrained, unqualified, or unlicensed individuals. Manipulation of the cervical spine is often performed with the patient lying on their back. The patient's head and neck are gently supported and positioned. A carefully controlled impulsive force may then be applied. By taking into account the normal biomechanics of the neck, we can thoroughly palpate, mobilize, and safely and comfortably manipulate the cervical spine. The best research now available indicates that risks of injury associated with cervical manipulation are extremely low. Such procedures serve to restore joint mobility, enhance circulation, decompress impingement, and reduce irritation to nerves. By using a specialized table with a slotted facepiece, the patient can comfortably lie on their stomach while the lower neck and thoracic spine are manipulated. The hands are used to identify areas of the spine that demonstrate restricted motion and tenderness. Spinal manual therapy techniques are then used to improve function and relieve pain. Repetitive shallow thrusting movements are generally appreciated and well tolerated by most patients. Depending on the technique used, manipulative procedures may be accompanied by a popping sound. Popping or cracking sounds are not necessary for successful manipulation to occur. Spinal manipulation can provide relief for many cases of back pain, neck pain, headache, and related mechanical spinal disorders. Soft tissue connecting the shoulder blade to the spine, as well as the joints that connect the rib cage to the spine, can also be treated in this position. With the use of a specialized treatment table, the lumbar spine can also be treated with the patient lying on their stomach. Flexion distraction is a manipulative technique that was first introduced by the osteopaths in the early 1900s. Over the years, the equipment and techniques used to provide flexion distraction have been refined. Today, over 60% of chiropractors utilize flexion distraction in their practice. Flexion distraction provides an effective treatment for a variety of spinal conditions, including cases of common mechanical low back pain, disc involvement, facet syndrome, and stenosis. Studies have also shown that more than two-thirds of patients report excellent to good improvement with a typical rehabilitation program of approximately 12 visits of flexion distraction. Motion palpation is a diagnostic tool that is used to identify areas of spinal joint dysfunction. The skillful performance of these maneuvers require that the examiner have a highly developed tactile knowledge and understanding of spinal joint function. During the procedure, the joints that are examined are moved through a range of motion as the practitioner assesses the degree to which joints may be locked or where there are limitations or variances from normal expected motion. Spinal segments that demonstrate reduced mobility can then be manipulated with the goal of restoring more normal motion to the involved area of the spine. Spinal manual therapy comprises various treatments that are delivered by the practitioner's hand, including many forms of manipulation, chiropractic adjustment, mobilization, and deep soft tissue massage. Another effective method for manipulating the spine employs pneumatic drop sections, which are incorporated into the surface of the treatment table. When the manipulative force is applied to the body, the table quickly lowers a short distance, carrying the affected joint safely through the range of motion. Through the use of various contacts and stabilizing forces, the practitioner can manipulate the thoracic as well as lumbar spine and sacroiliac joints in the side posture position. Such procedures allow the introduction of side bending and rotation movement. I hope you found this video informative. The procedures demonstrated in this video should only be provided after consultation with the doctor who has examined the patient and is familiar with the patient's health history. In addition to these procedures, patients may need to take a more active approach to facilitate recovery. Improved posture during activities, safe lifting techniques, and exercising to enhance spine fitness may also be advised.